In 2011, I was a patient in 9 ICU, room 5, for 7 weeks. When I was admitted, I was bleeding so badly, and I guess I was in fairly critical condition. In one 12-hour nursing shift, I received 19 units of blood. My particular nurse on that 12-hour shift would greet me by name and ask me how I was doing and touch my shoulder, ask how my family was doing. That is what meant the most to me.
We get emails and letters from patients all the time, and it's amazing how detailed they are when they can go back and remember a certain person, what she or he did, how he did it, the care in which he did it.
For someone to say that they have cancer, and you have to go and get treated and have chemo, and yet actually look forward to it. I would get up in the morning and actually look forward to coming here because the folks at the reception area, there's a young lady who started as a temp about the same time that I started, named Chanel Smith. She was always smiling, always cheerful. It's almost kind of like I look forward to seeing her.
After my daughter Cora had her first open heart surgery when she was 8 days old, she was very, very ill. And I'll never forget the visual of the attending physician, Dr. Peter Oishi, sitting in the middle of the hallway. He had a rolling chair in between Cora's room and the little baby next door because they were both quite ill. And he just posted up there for hours and just watched over them. And it was a visual that stuck with me of being protected and cared for, and that nothing else in the world was as important for him as it was to look out for our daughter. What I would say to our caregivers is just every time you talked to us about our other kids, every time you asked how our weekend was, every time you changed Cora's sheets and used what we had brought and made her room beautiful and honored her the way we would want her to be treated, and every time you showed us parts of yourself, you were arguably doing more for our family than any other treatment.
One of the things that I was most guilty of in the beginning of my career was I would charge into the room with my own agenda, ready with my own questions, and peppering the patients with those questions. But I found that a lot of the times when I did that, I still hadn't truly uncovered why the patient was there or what they were worrying most about. And if you just start out by listening, one, they understand that, wow, this person's spending a lot of time with me. They really want to understand what my questions and what my concerns are. And two, you really are able to then connect with somebody on a human level. You don't become just an entity coming into the room, asking them about their health. You become just another human being who is trying to reach out and connect with them.
It's the simple things. Know my name. Know my history. Have an idea as to why I'm there. When talking to a patient, instead of assuming that they understand because they didn't ask questions, communicate with them that you are open to questions, that you want them to feel comfortable, because some people are just afraid to ask the questions.
For the most part, I was on 24-hour-a-day dialysis. 3 times they tried to do just individual dialysis sessions. And one time that they tried, my daughter had just flown in from Houston that morning and come from the airport to the hospital. The technician showed up and said that she couldn't be in the room because I needed to be kept quiet during dialysis. And so for the next 3 hours, the technician sat there and read a newspaper and glanced over at the machine, and I laid in bed, and my daughter, who had just flown in from Houston, sat in the waiting room. I would have loved to have my daughter tell me how her life was going and what was going on. And even if she just sat there and read, I was a good patient. I tried to follow the rules, and I think in certain cases, some of the rules can be bent a little bit to give the family more time.
There are silly things that make a big difference, like knowing whether the baby in the bed is a boy or a girl. That was always a joke, but when people would round, they would often refer to babies as he or she when that wasn't the right gender. Sometimes rounds would start with, "This is our coarctation of the aorta in bed 8," versus "This is Cora, little beautiful girl." As a parent, those things leave a mark.
Whether I am a bedside nurse and or I am helping on a project, that I am taking care of those folks like they are my family. So, you move from that perspective and you always make the right decision. It doesn't matter what hat you're wearing in the room. If you move from the patient's perspective, you make the right decision.
I would say to the doctors and the nurses, I love you guys. You're phenomenal. The care and love that you have for your patients come across, and I don't think I'd be alive today if not for that love and care.
If I were talking directly to the staff of the cardiac ICU, I would say, thank you. There's no one better in the world at what you do. Don't underestimate the power of friendship and warmth and love and comfort as something that you're here to give, and an impact that goes far beyond the treatment that you give. We're so blessed to have interacted with you and to have received care in such an extraordinary way.